My name is Chandra Pasma and I'm the Ontario NDP candidate for Ottawa West-Nepean. I'm very pleased to be joined here this morning by Joel Harden, who's the Ontario NDP candidate for Ottawa Centre, along with nurses from the Ontario Nurses Association. I've been knocking on doors for almost a year across Ottawa West-Nepean, and almost every day I hear a horror story from someone who's had a 10 or 12-hour wait for healthcare at the Queensway Carleton Hospital, or someone who's called an ambulance and then had to wait for 2 hours for the ambulance to arrive while they wondered if they were even going to survive. I've talked to families and loved ones who had residents in the Carlingview Manor, which was one of the worst outbreaks in the entire province during the pandemic. People who are afraid to put their elderly parents into long-term care, but also know that the home care that they need isn't available. Parents who are worried about their kids, who aren't getting the mental health supports and special education supports they need after 3 years of disrupted schooling. And of course, lots of concern about climate change. In the past 4 years, we've had a tornado, a massive storm that took power down. Some residents still don't have it back now after 9 days, and 2 once-in-a-century floods here on the Ottawa River. And Doug Ford has done nothing about any of these concerns. In fact, he's made these problems worse. But we also know that these problems didn't start with Doug Ford. They started under the Liberals, who had 15 years, but did nothing. In fact, hallway medicine started under the Liberals. Our classrooms were crowded under the Liberals. They had 15 years to address privatization and crowding in our seniors' care, and they did nothing. And yet, Stephen Del Duca is running away from his record and pretending he has nothing to do with it. Folks in Ottawa West-Nepean and across Ottawa know that there's only one leader that's on our side. Only one leader that's working to fix what matters most to us, and that's Andrea Horwath and the NDP. They know that the NDP has a plan to fix the housing crisis and to make life more affordable, to address hospital care and seniors care and make sure that our kids get the best supports that they need. That's why we need to come together and elect Andrea Horvath as the Premier of Ontario. So I'd like to introduce our next Premier, Andrea Horvath.
Well, good morning, everyone. Thank you so much, Chandra, for the introduction and for your comments, because they're right on the money. And before I talk a little bit more about the topic that we're here to discuss this morning, I do want to acknowledge that there are still thousands of people, thousands of Ottawans without power, and I just want you to know we'll always fight not only to make sure that you get your power reconnected and back up and running, but making sure that our disaster relief programs are working for people, for small businesses, and for communities. And we know that that's not a great system right now, and it needs improvement. I also want to take a moment not only to thank Chandra, but to thank Joel and all of these nurses that are with us this morning. And our message to everyone in Ontario is that we can fix what's broken in our healthcare system. We can hire more nurses. We can respect them and make sure that we are adding more supports to the ones that are there right now, but also make sure that there are more nurses being hired into the hospitals and every healthcare setting that we have, because it has been really troubling to see what nurses have had to deal with in the last number of years. I was just chatting with these wonderful nurses here, and they are telling me horror stories about what they and their colleagues are facing day in and day out as they try to do their best to provide the health care that people deserve and that people need. Right now in Ottawa, there are some 247 nurse vacancies, and I want to let people know that we can hire those 247 nurses, as well as increase the number of nurses overall in Ottawa's healthcare system. We have a plan to hire 30,000 more nurses into our healthcare system. We have a plan to hire 10,000 more PSWs into our healthcare system, because we know that our healthcare system has been falling apart. And we want to be sure that people have an understanding that we can have hope. We can have hope that the healthcare system can be fixed with the hiring of these nurses. With our plan of 30,000, that would mean 2,050 more nurses for the Ottawa area hospitals and other healthcare facilities, on top of the 247 that are now short in terms of the vacancies. We can make sure that nurses are respected by getting rid of Bill 124, scrapping the low-wage policy that disrespects nurses in Ontario and has been chasing them out of the healthcare system. We can make sure that we are returning our nurses that have left the system, and that we're creating new positions for late career nurses to help us with mentorship and with training. We know that there are thousands upon thousands of internationally trained nurses that we can help to become accredited. Those folks stayed on the sidelines while we were battling COVID-19 because we don't have a system that enables them to use their skills and to become accredited here in Ontario. So we're gonna fix that as well. There is hope that we can fix the healthcare system, that we can hire more nurses and make sure people don't have to face the kinds of situations that Chandra was describing. Together we can do that. We have the opportunity on Thursday to come together to vote for the NDP, the only party that's prepared to fix what's wrong in our healthcare system. And what I can tell you for sure is that our plan not only will work, it will make a difference. It'll make a difference for these hardworking nurses. It'll make a difference for your families, for our healthcare facilities. We can fix what's broken in healthcare, and that's why I'm asking people to come together to do that. Come together, cast your vote on Thursday for the NDP, and together we can fix what's broken in our healthcare system. I'm honored to be able to introduce a particular nurse who's agreed to speak about her experience and the things that she wants Ottawans to know about what's happening. She's a registered nurse. Her name is Cheshta Sharma, and I'm going to ask her to say a few words, and then we're going to wrap up the formal comments and go to questions. So, Cheshta, thank you very much for being here. I look forward to having a sense of what you think the people of Ottawa need to know. Thank you.
Thank you so much, Andrea. Thank you, Joel. Thank you, Chandra, for giving us the opportunity to be here today, giving nurses a voice today to be able to speak about what we've been through over the past few years. My name is Cheshta Sharma. I've been working for over 12 years as a registered nurse at one of the acute care settings and surgical settings in Ottawa. And I have had the chance to serve our community, to take care of patients in Ottawa for years. And when I first started this job in this profession, I was told by patients, I was told by my colleagues, by managers, how I used to have a smile on my face every single day when I showed up for my patients. And unfortunately, because of how rushed we are today, because of how task-oriented healthcare has had to become because of the shortages, that is not the case anymore. We cannot smile because we are not happy that we cannot provide the compassionate care for our patients that we need to, that we want to. We signed up for this profession to take care of people when they are at their worst, they are feeling most vulnerable, and we cannot do that because unfortunately the previous government, the PC government, has passed bill after bill against nurses, against healthcare professionals, and against our public, because he has put our public at risk, our patients at risk. We see this every single day. I've seen my colleagues struggle. Every single day we go to work, we're anxious, we're afraid of what we might find, how short we will be, how we will not be able to potentially take care of our patients. We'll be redeployed, we will be floated to other floors and not have the help maybe, or we will have too many patients that we cannot pay attention to, we cannot care for as we would like to. So the quality care we want to provide, we cannot provide. We need to repeal Bill 124. We must elect a government now that will repeal Bill 124, Ford's wage cut law, that will help us hire 30,000 more nurses in Ontario to cover the shortage we're currently experiencing, that will phase out for-profit long-term care. And I need to emphasize this. We need to bring back, we need to create more positions for our retired and late career nurses, to bring back the nurses so they can train our new staff that we will be hiring. We need this now. Ontario needs this now. We do not have an option. Our healthcare system is crumbling every single day. Every single one of us here today, every single person in Ontario will need healthcare, whether it's to have a child, whether it's because you're sick, because your loved one's sick, we will need healthcare. So we need to stand up now. This is our right. We need to stand up for nurses. We need to protect nurses so our nurses can protect our patients, your loved ones, your family members. Thank you so much.
Thanks so much, Cheshta. You've really passionately described the crisis that we're in here in Ontario, and also the solution. And that's why I'm proud to say that we can bring those solutions forward. We can fix what's broken in our hospitals, in our long-term care sector, in our community care sector, in our home care sector. We know that nurses are the backbones of our healthcare system, and we want you to know that we do respect you. We do know how valuable your work is and how important it is to ensure that you're able to do that work with the number of colleagues necessary to provide the quality care that you know people deserve. And so my last comment is this: not only is there hope that we can do this, but there's an opportunity. There's an opportunity to do this together on Thursday, to vote for healthcare, to vote for nurses, to vote for the well-being and the attention that all of us need and deserve in a public healthcare system that's there for us each and every time. Whether you're, as Cheshta was saying, whether you're going to have a child, whether one of your loved ones is needing home care or long-term care, whether somebody's had an accident or an injury and needs to be rushed to the ER, we know our nurses are there. Just imagine getting back to a place where you know that if you go to an ER, you're going to get the attention you need right away. That if your child is sick and you have to take them to CHEO, that you know you won't be there for hours and hours and hours without having anybody look at your baby. These things can happen. And they will happen with an NDP government. So I urge the people of Ottawa and the people of Ontario, let's remember how important our public health care system is. Let's support our nurses and let's fix it. Let's fix what's broken. Let's fix what matters most to all of us, and that's our health care system. We have a chance to do that. Please go out and vote on Thursday to fix health care, to respect and support nurses, and make sure that we get the quality care that we all need and deserve. On that note, I'll take any questions that folks might have.
We'll move to on-site questions first. First question comes from Charlie Pinkerton from QP Briefing.
Good morning, Andrea. Thank you. I know. Thank you very much. Yesterday, Andrea, the federal Liberal government tabled its most recent gun legislation. That, of course, would change the landscape of this issue in Ontario and when you would become Premier if you're successful on Thursday. From what I have read about your platform, your promises around guns are rather vague, but given this sort of new reality and the fact that this bill should pass federally, I'm hoping you can tell me about what an NDP government would do specifically to continue trying to cut down on gun violence.
It's a great question, and it's terrifying to see just how bad gun violence has become. And there's a couple of things that I think we need to acknowledge. But first of all, it's important to acknowledge the trauma that happens with gun violence, not only for those folks that are involved in the shootings as victims, but their families and their communities as well. It is very, very traumatizing. We know that handguns do not belong in urban areas. We shouldn't have guns in movie theaters, in shopping malls, in schools. We shouldn't see handguns in those settings, and so a ban on handguns in urban settings is something that we're committed to. But we're also committed to doing the work that should have long been done to prevent and help young people avoid connections with gangs. A very long time ago, the then Liberal government did some some work on the roots of youth violence. Unfortunately, the recommendations from that report were largely ignored. We need to support young people. We need to make sure that their experience in their education system is supportive and helps them to know that there's hope that they can have great careers and good jobs in this province. We know that communities that are traumatized need support, and that young people who have seen their siblings lose their lives to gun violence need support as well. So it's more than just the gun piece. It's finding ways to support communities. Doug Ford and his government cut programs and funding to help youth. They cut those programs. They've cut and watered down, for example, community benefit agreements for infrastructure projects like LRTs and subways. That's a mistake. We need to support young people. We need to provide them with hope and opportunity that keeps them away from gangs, and that's the other piece of the puzzle that both Liberals and Conservatives have not addressed over the years, and gun violence is getting worse. So yes, it's the handguns, getting rid of handguns in urban settings particularly, but it's also making sure we provide hope for young people and the supports they need to prevent them from turning to gangs.
And on a different topic, much earlier in the campaign, your party announced a promise to give homeowners up to $11,000 for home energy retrofits. Affordability, of course, has been one of the main topics discussed in this election. But I'm wondering why this promise? Why give homeowners money when this is certainly not the group of people who are struggling for cash? Why not something targeted to help renters and work towards the same goal? I'm just hoping you can explain that.
Well, absolutely. We have a lot of great supports for renters. We're going to bring rent control back to Ontario. We see too many bad apple landlords that are rent-evicting tenants. And we've watched as first the Harris government, the Conservatives, got rid of rent control in Ontario. And then for 15 years, the Liberals didn't fix what Mike Harris and his team broke. And so we can't trust the Liberals to fix it this time. And that's why we've made solid commitments to renters. Renters should be able to be secure in their housing. They shouldn't have to worry that a bad apple landlord is going to force them out. But when it comes to the grants to help people with retrofits, it's important that everyday families know that they can not only save on their energy bills with retrofits, but also do their part when it comes to fighting climate change. But lots of people, especially right now, they don't have thousands and thousands of extra dollars to change their water heater, to put in energy efficient windows, to maybe put solar panels on their roofs. They don't have that extra cash. In fact, the likelihood of them having that kind of extra cash has been dwindling right before our eyes with the cost of everything going up. So what we're saying is we will provide you the grants to help you do those things, and that not only helps us meet our targets in terms of greenhouse gas emission reductions in this province, but it also helps you to save money on your own bills.
Next question comes from Joanne Chianello from CBC.
Hi, Joanne.
Hi, Ms. Horvath. I also have a housing question, and it is, Doug Ford says that you folks, the Liberals, you want to stop building houses, right? And that's a problem. He's up for building lots, and you guys are not. What do you say to that? What are your thoughts on how you can improve housing affordability for people?
Thanks so much. Well, Doug Ford's making stuff up again, which is what he likes to do, but it's absolutely not the case. In fact, what our plan does is make sure that the range of housing that's available for Ontarians is available in ways that help them to afford it. So, for example, we believe that the missing middle housing needs to be addressed. We don't believe that building massive highways to mansions that nobody can afford for the purposes really of paying off your big fish buddies in the development sector is the right direction for Ontario. It doesn't create the entry-level starter home types of homes that young people used to be able to dream that was their pathway into the housing market. So we want to see more of the missing middle homes built, and we're gonna put policies in place that spur that kind of development. Things like semi-detached homes, like duplexes, triplexes, townhouses. Those are less expensive and will help in terms of providing that opportunity. But we're also going to help young people or first-time homeowners, first-time home buyers with help with the down payment. People have been saving for years now. I met a young person not that long ago. In fact, he was in his 30s, and he said he and his partner had been saving for years and years and has saved up about $80,000, but finally realized that there's just no way. They both have secure jobs, decent jobs, but there's just no way that they're ever going to be able to buy a home in our province. That has to be addressed. And so not only is it a matter of making sure that housing's available, but that we are giving people a chance to actually come up with that down payment with a 10% shared equity loan from the government. But that's not the be all and end all of the housing crisis, and we know that. We see how many unhoused people are in our communities. We know that we have to build more affordable housing. We know that we need supportive housing to help those folks who need to be housed but might need a little bit of extra support to be able to maintain the housing. We know that we need to continue to provide rent supplements for people who are just not able to quite make it in the private rental housing market, and all of those things are part of our plans. Housing is a basic human right. How do you do anything in life without having a stable, affordable, decent quality roof over your head for you and your families? You can't. Housing is extremely important. Lots of solutions. There's not one silver bullet. And of course, we do have to make sure we get the speculation out of the market and keep it out so that we don't have huge companies and deep-pocketed investors buying up all the housing and leaving the crumbs for people here in Ontario who want to buy those houses as homes.
And my follow-up is a political question, just a warning, and that is, the election day is 2 days away, as you well know. This is your fourth campaign. What is your threshold for staying on as the NDP leader with via the results on Thursday?
Well, I'm going to wait to see what the people of Ontario decide. I hope they vote for hope. I hope that they vote for hope in terms of the things that we know that are broken but can be fixed, the things that matter to most of us. Once they make their decision, then that will determine what goes forward in terms of me personally. But it really has never been about me. I've always fought for people. Before I was elected, when I was first elected to City Council, it's my passion. And so whatever happens, what people will know, what I can tell Ontarians is that I will always be fighting to make life better for everyday families. Everyday people in this province should be able to afford everyday life, and that has not been the case for far too long. So I'm going to just keep fighting for people up until Thursday and then after Thursday as well.
Next question comes from Stephanie Taylor from the Canadian Press.
Hi there. You're here talking about how Mr. Ford mismanaged healthcare, mismanaged the pandemic. You say he's ignoring climate change. He's thrown the education sector into chaos. So why does it appear, though, he's cruising to a second majority?
Well, I think people have an important decision to make. I mean, look, this is an election at which there's a lot at stake. There's a lot at stake in this election. And what we are doing is letting people know that you can have hope, not only when it comes to the things that you talked about, our healthcare system, which these wonderful nurses are talking about this morning, the education system, which parents and students and educators are very, very concerned about in terms of the direction that Doug Ford is taking us. But it's also about knowing that there are solutions to these challenges, and that together we can fix the things that are broken, and that we can have hope. But it's also about acknowledging that there are things that people are not able to access. So we've talked about some of the big pieces that Doug Ford is failing us on. But we've heard, so I can't tell you how many times, each and every day, at least once, and sometimes more than once, especially now that we're doing 4 or 5 or 6 or 7 events every day, But what's not positive about that is how many times a young person approaches me to talk about their mental health or the mental health of their peers. How many times a parent or an aunt or an uncle takes me aside after the lights are all off and the cameras are all shut down and has a serious conversation about the young person in their family that's struggling, that may be self-medicating, that may be heading into a serious addiction problem because they never got the mental health care that they needed. We can fix that. We can give people access to mental health services and make sure that that access is paid for by your OHIP card, not your credit card. We hear similar stories about people who are, and I have heard similar stories throughout this campaign, about people who literally have abscessed tooth, for example, an abscessed tooth that lasts 3 years until that person finally, after taking all kinds of painkillers for those 3 years, finally feels that it's justifiable for her to go to an emergency department to get that abscessed tooth dealt with. People are showing up at emergency departments constantly to get their dental issues dealt with. We can make sure that people have access to dental care, make sure that people can afford the prescription drugs that they need through a public prescription, a public Medicare program that provides access to prescription drugs with your OHIP card. These are things that not only will help people to afford to do the things they need to stay well and healthy, but it also takes pressure off of the healthcare system and ensures people have a healthier life. So it's not just the failures of Doug Ford and the things that we can't trust the Liberals to fix because they broke them in the first place. It's about looking forward and helping people to build a better life here by taking the pressure off their pocketbooks on things like mental health care, like dental care, while also taking the pressure off of our healthcare system and ensuring people have their healthcare needs met.
If Mr. Ford does win a majority, would you consider that a failure on yourself as leader?
I think that what we need to do over these next couple of days is reflect on what's broken in our province and the fact that there is hope that we can fix those things. There's a lot that COVID has shown us. COVID has laid bare exactly where the failures are and what we need to do to address them. And so whether we're talking about healthcare, which we are this morning, or seniors care, which Cheshta was talking about as well, whether it's making sure our schools are there to support our children, that we have a mental health care system that provides people with the supports we need. Those are the things that I'm focused on because I know that's what everyday families struggle with all the time. And the important piece is that there is hope that these things can be fixed. There is hope that the things that matter to all of us, that matter most to all of us, can be fixed this time around. And that's why I'm urging people, let's come together on Thursday. Let's come together on Thursday and fix the things that matter most to all of us, including making sure that we have the nurses across our healthcare system to provide all of us with the healthcare and support that we all need.
Next question comes from Blair Crawford from the Ottawa Citizen.
Good morning.
Good morning, Blair.
You said that in your handout here that you'll address the case of, or the instance of violence against healthcare workers. You've written a number of stories about Code White cases like this, and I wonder if you could be more specific about what an NDP government would do to address that.
One of the things that we know is that the pressure in our healthcare system, the pressure on the various hospital wards, the pressure in many of the healthcare settings in our province is increasing and not decreasing. And part of that pressure is because there aren't enough staff on the wards. There aren't enough staff to be able to provide the quality of care and the access to care that people and families need. When you have folks lined up in stretchers and gurneys in hallways, thanks to the Liberals, frankly, that is not a good quality of healthcare. And so tension rises and people become upset. When the nurse has to deal with 20 patients on a ward because there just aren't enough nurses, then the people who are in those hospital beds aren't getting the attention that they need, and that upsets their family members. It upsets them and upsets their family members. And so So a big part of solving the pressure that exists, that's come to a boiling point in so many of our healthcare systems, is exactly the things we're talking about. Make sure we're paying those healthcare workers a decent wage. Make sure we're respecting them by scrapping Bill 124, and that we're providing the number of peers and supports that they need to do their jobs properly. And when these kinds of instances occur, make sure that we're providing not only the physical help that they need to deal with an injury, but also the mental health supports that they need, because they're stressed out. They're facing a lot of anxiety. They're burnt out, and we need to support them so that they can heal themselves as well.
Second question, and this is one I put to Mr. Ford yesterday, but there's
On the roof?
on the higher above sea level. Yes, there was about 50,000 parents and families waiting for autism services. What would the NDP government do to address that backlog?
Oh, it is absolutely tragic and hurtful what Doug Ford has done to children who have autism and their families. Children living with autism and their families were sold a bill of goods by Doug Ford, and things have become so much worse. In fact, we were just having this conversation, myself and some of the nurses here, about how far backwards we've gone when it comes to supporting those families. In fact, the story I was being told was about a family that is paying $1,000 a week. $1,000 a week to support their child, and they've remortgaged their house now. These are the same stories I was hearing 6 or 7 years ago, when families and children who are dealing with autism in their families were on the lawns of Queen's Park constantly trying to get help for their kids. So first and foremost, we will not put arbitrary age caps on access to service. The age caps will be gone, and every child will be able to get the kinds of supports and services that they need. We're going to clear that wait list by investing in autism services for our kids, IBI, ABA services. Part of the doubling of the wait list, really, the Ford government has literally doubled the wait list from 25 to 50,000 kids now. That's painful. It's hurtful. Parents have had to watch as their children have regressed. The progress that they have made has regressed. It's gone now. But on top of all of that, we've also seen people leave the profession. The providers of service are gone because they have no place to work, because the government has not been providing a system of care, a system of services for our kids and for those families and their kids. And that's going to change. So we're going to not only make sure that we have a system that is providing care based on the needs of every child. So it's about the child's needs, not about arbitrary, one-time payments or arbitrary structures that don't support the child in terms of their particular needs. We will not be doing that. We'll make sure every child gets the care that they need, the services they need, the IBI or ABA that they need based on their needs, and certainly without arbitrary caps in terms of age.
Next question comes from Jean-Francois Dugas from Le Droit.
Hi, I'm just, when you were last here, I asked you the question, I'll ask you again, about, you're saying that the Doug Ford government pretty much scrapped everything. We know how the polls are going right now. Is there, and you just said actually that it's not about yourself, but the party. So is there any consideration for maybe forming a coalition with the Liberals to make sure the Conservatives don't go through, or afterwards to beat them, basically?
Well, considering how much is broken in Ontario and how much worse things have become since Doug Ford took office, job number one is definitely to make sure that Doug Ford is no longer the premier of this province. Because much of what has been broken was broken by the Liberals, we can't trust that they're going to fix it. We can't trust that they're going to fix it because they broke it in the first place. What I'm asking the people of Ontario to do this time is come together. Come together behind the NDP. And support your local NDP candidates because we are strong, we are ready, and we're always working for you to fix the things that matter most. People will have their say on Thursday, but what I can guarantee you is that we will do everything that we can up until then to show people that when we come together, we can defeat Doug Ford. We had in the last election 100 out of 124 seats. We came first or second. Chandra's a good example of that. She came second in Ottawa West-Nepean. This time, let's make sure she comes first. And we know how to do that. We know how to do that by voting NDP. There are, as I said, we did gain 40 seats all told last time, which means there are 60 seats out there in Ontario where we came second. And we're asking voters, if you want to see your healthcare system fixed and nurses respected, if you want to see autism services fixed, if you want to make life more affordable for yourself and your family, while we're fixing the things that matter most, this time, your best bet, your best shot is a vote for the NDP. And together, we can defeat Doug Ford and fix the things that matter most to all of us.
Okay, seeing no further on-site questions, we'll move to Zoom. First question comes from Richard Southern from City News.
Morning, Richard.
Ms. Horvath, good morning. Good morning to you. Your official Twitter account yesterday afternoon tweeted out a tweet. It reads, quote, "Blood work is healthcare. It belongs in OHIP." I assume you're responding to a number of claims on Twitter from people who were saying they were charged for blood tests that used to be covered. We've been unable to substantiate any of those claims. The Ministry of Health and Life Labs both denies that anything has changed. Do you have any new information that we don't have on this, Ms. Horvath?
I met somebody yesterday, in fact, who told me that they had to pay $80 to get their cancer screening blood tests done. So there's something amiss here, and people should not have to dig out of their pocket to get any kind of screening done that will determine whether or not they have an illness or a disease that needs to be addressed in our healthcare system. And that's what we are saying. It should never depend on how deep your wallet is, how big your wallet is, rather, how deep your pockets are. Universal public health care should be available to everyone and have nothing to do with your amount of income, your source of income, or how much you have saved in the bank, or your access to credit cards. Let's face it, we have a universal healthcare system. We have to protect it, and we have to expand it so that people can get mental health, so that people can get dental health care with their OHIP cards, so that everybody can get the prescription drugs that they need and never have to walk out of a doctor's office and tuck the prescription in your back pocket knowing that you'll not be able to afford to fill that prescription. That's what universal public health care for the whole person, that's what it looks like, and that's what New Democrats are going to bring to Ontario.
Ms. Horvath, at this point, this appears to just simply be misinformation, bad misinformation. If your campaign is able to substantiate these claims, I'll look at them. We have not been able to substantiate these claims, yet here you are repeating them. Do you think that's responsible?
I'm repeating something that someone told me directly, and that's what I'm doing. And what I want to assure the people of Ontario is that New Democrats believe in public health care. What we've seen over many years now are cuts to our public health care system. The Liberals gave us hallway medicine. They fired 1,600 nurses. They delisted a number of services from OHIP. Most people don't remember that, but that's exactly what the Liberals did. They delisted. Well, we are going to list new things in terms of our OHIP system because people deserve to have the public health care that they need to stay well and address their illnesses and diseases. But we're also the only party that has consistently refused to go the privatization route. Liberals privatized in home care, privatized in long-term care. Conservatives not only have done that, and Liberals actually brought more private clinics into Ontario as well. Doug Ford wants to privatize more and more of our healthcare system. We can't let him do that. We can't let him do that. Our public healthcare dollars should be going to services for people, not to private profits for corporations, not to return on investment for shareholders. There's only one party that consistently is committed to and will always be committed to a truly public universal healthcare system that doesn't build in profits for Doug Ford's buddies or connected Liberal insiders. but it's always there to make sure you get the services that you need and that every public dollar goes to frontline care for people.
Next question comes from Rob Ferguson from the Toronto Star.
Morning, Rob.
Oh, sorry. Good morning. Can you hear me now?
I can, yeah.
Okay, great. Thanks, Andrea. I'm just going to pick up where Joanne left off. And I'm just curious to get a little deeper into, you look at the polls, you're bringing up all these concerns about healthcare and long-term care after what everyone saw in the pandemic and, all the deaths in long-term care and whatnot. Why can't you make this resonate more than it is, more widely yet?
Well, it is true that we saw 4,540 seniors lose their lives to COVID-19 in long-term care, but also to malnourishment and to dehydration. That's what the Canadian Armed Forces showed us. The other thing that COVID showed us is that when we come together, we can successfully care for each other. I think that's something that COVID has shown us and that we can't forget. Now is the particular time in history where Ontarians did, for the vast majority of Ontarians, we came together. We came together, we took care of each other, we did the things we needed to do to protect each other, to protect our communities, to protect our senior citizens, to protect our most vulnerable. That's the kind of community spirit, of commitment to each other that we can have all the time if we come together this time and support a party that is going to fix the things that have been broken by the other parties. And so when I talk about things like universal health care, and when I talk about things like making sure that people can get the dental care, the mental health care, the prescription drugs that they need, that we can make life more affordable, that we can make sure that people have the kind of housing that they need to be able to build good lives here. When we talk about making sure that nurses are on the front lines for us, when we talk about the fact that our educators, that our schools need to be there for our kids. Who cuts education during a pandemic? Doug Ford does that. That's what Doug Ford does. So there is an overarching lesson, I think, not from what we experienced with COVID. Not only the lesson that we need to learn about what's broken in our systems, whether it's hospitals, whether it's long-term care, community care and home care, whether it's a lab capacity, there are so many things. But the other message, maybe the more positive message, the hopeful message is that we know how to care for one another. And we know how important it is for us to come together and really make sure that everybody in this province has a great chance at building a good life. We know that everyday people should be able to afford everyday life here. We should be able to have people that get the access to the healthcare needs that they have addressed. We know that we should be able to have a public education system that supports our kids and that the most vulnerable folks in our communities get the supports and services that they need to have dignified quality of life, and including our seniors. That's what our message is, and I'm hoping that as people reflect in the next couple of days, they see the hopefulness, because it's not just about what's wrong and what's broken. It's about the fact that there's hope that we can fix, that together we can come together and fix the things that matter most to all of us and help everyone build a great life here.
Okay, thanks, Andrea. And as a follow-up, if you stay, if you remain official opposition leader with the results of the election Thursday night with a reduced number of seats, is that enough for you to stay on, or is that somewhere a point where you would say it's time to hand over the keys to someone else?
Well, Rob, what I will say is this: on Thursday, people will make their decision, and what I will commit to at this point is that I will always be fighting for people, and I will always work to make life better for folks. And Tuesday will, or rather Thursday will be a great opportunity for people to come together and fix all of those things that we know need to be fixed. And after that happens, it will determine what happens next. But I will never stop fighting for folks ever. It's what I did before I was elected for the first time back in 1997, I guess it was, to Hamilton City Council. And I've never stopped, and I never will. It's what makes me tick.
Seeing no further questions, I'll turn it back to you, Andrea.
Thanks, everyone. That's a beautiful day today. Not quite as humid as it was yesterday. Not yet, anyways. Great to be here in Ottawa to support Chandra Pasma, of course, and Joel Harden. Great candidates here in the Ottawa area. And to let our nurses know and our other healthcare professionals know that we're with you, that we will absolutely scrap Bill 124 and work with you to rebuild our healthcare system. And I just want to say how grateful I am that you're here with us today, but also for the work that you do each and every day in all of the healthcare settings that we know you and your colleagues are so dedicated to providing us the supports and the healthcare quality that we all deserve. Thanks, everybody, for being here this morning, and have a wonderful day.